Hi, it's David Ayres from Core Physiotherapy and Pilates Studio. Today we're going to talk about Pilates and how we use it as a rehab tool for our clients recovering from injury. Pilates has been around since the early 1900s, but it's since evolved with lots of science behind it that in the hands of a really well-trained health professional, it can be used as a really good tool for rehabilitation. Pilates is basically broken into two different streams. We've got mat Pilates, where it basically involves a large group of people doing the same exercises, typically seen in a gym type environment. And the goals of those programs are normally just to generally improve strength, flexibility, and core stability. And then we've got equipment-based Pilates, like the studio that we're in today, which we're able to basically individualise and tailor our programs more specifically for each client that we have, and focus on a range of different injuries, from shoulder injuries to back injuries, knee injuries, and all sorts of those things. So we found from our clinical experience that using the equipment-based Pilates system has been far more useful for us in terms of dealing with injured clients that are trying to rehabilitate back to their prior function. We use Pilates for a wide range of different conditions, from teenagers with postural pain, workers with back pain, right through to the elderly following joint replacement surgery. Beginning a Pilates program normally starts naturally as a progression from the treatment that they've already been having, or it may be that you've been having some passive treatment already that's not really getting to the bottom of the problem. The symptoms are getting relief from the treatment, but the symptoms keep coming back. So, looking at Pilates can be a way of, trying to identify some of the causative agents that might be causing the injury to keep coming back. We also see with Pilates people getting referred by other practitioners, so doctors, other physios and chiropractors quite often refer us people to try and continue on that rehabilitation and support their clients. So Pilates is really useful in trying to improve your posture, flexibility, your stability around your joints, and also your general muscular strength and condition. So beginning a Pilates program starts with a thorough assessment of your injury, and then we go through a number of one-on-one sessions where we take you through a series of exercises specific to trying to work on the factors that we've identified in your assessment. So we're going to go through some of those exercises with you now, just to give you a bit of an idea about how Pilates functions in our studios. So to start with, we've got Scott here. Scott's going to demonstrate an exercise on the ladder barrel. We're going to get Scott to just roll over the ladder barrel and stretch back with his arms. So the idea with this exercise is that we're getting some mobilisation through his lower spine. We're working on some strength through his abdominal muscles and also some dynamic stability around his core. So that's a nice little exercise for some of our people with back problems. So we're then going to move across to Nick. Nick's going to show us the knee stretch, which is a really common exercise that we use for people to try and work on their posture through their upper trunk, stability through their back and pelvis. And it's a really functional position, so it's the sort of position that you'd use when you're lifting to try and protect your spine, keeping your back nice and neutral through here. So then we can move over to Olivia, and Olivia is going to show us a nice little postural exercise. So the exercise that we're going to do is just to focus on her posture, keep her shoulder down, and then just trying to move through her arm. So keeping down through here. Okay. Okay, excellent. All right, so when we're going through our Pilates, basically once we've set up a program of exercises that's appropriate for our clients, we then get them into a group session. The group sessions normally involve a group of less than 6 people, all performing their own individual movements, supervised by a physio. The physio will continue to assess and make sure that you're doing your exercises appropriately and progress them as they see fit. So we can see how Nick's progressed on to doing a more complicated movement, the jackrabbit, and Scott's moved over here and he's doing something a little bit more complicated as well. And Olivia, we can get to show how we just stretch up and over So just to stretch up and over there, Olivia. So push, yep, so push up and then stretch over. Good. And then back to there, yep. Okay, so in closing, we've shown you a bit about Pilates, so hopefully you got an idea on what it actually is now. If you're interested in starting to look into it yourself in your rehabilitation, then book a time with one of our physios and they can give you a really good indication on whether it's suitable for you and get you started on a program.